Good afternoon, and thank you for joining me today. I'm reporting that we've had 2 new test-positive COVID cases within the last less than 24-hour period, and would like to provide a little bit of detail about those cases. The first is a woman in her 40s who presented to South Lake Regional Health Center on Friday, March the 13th, and came back with a positive test result and is now isolated at home. We are investigating close contacts in her household. The second is a man in his 70s who presented to Royal Victoria Regional Health Center in Barrie on Wednesday, March the 11th, and came back positive with the test result as well. He is being treated at RVH and is presently in serious but stable condition. RVH is presently with us investigating potential contacts among staff related to this particular case. Those cases will be managed to protect themselves and the public with home isolation or self-monitoring as indicated by the specifics of their situation. This individual did have close contact with another individual who recently passed away at RVH, and so we are investigating that situation as well. The investigation of the contacts of the cases continues, and we'll be providing information to those individuals, management of those individuals as required. We would like to indicate that a confirmed case stayed at the Hampton Inn in Barrie March the 5th to the 11th, and we're asking those who stayed or worked in this location to self-monitor for a 14-day period starting from March 11th onward, and to isolate themselves if they develop symptoms, and to contact ourselves at Public Health, Telehealth Ontario, or their healthcare provider. They should, when seeking medical attention, call ahead to the facility that they'd be going to so that they would be prepared to receive them, and make arrangements to avoid any exposures of staff. We'd like to remind people at this time that we're calling upon people to take protective measures for themselves, to exercise what we call social distancing, which is keeping it 2 meters apart from others when you're out in the public, to wash your hands or sanitize your hands frequently, to avoid certainly people who are obviously ill, to go into isolation if you develop any symptoms, and to seek the medical assessment, medical attention that I already cited. So at this point, I'd be happy to take questions.
Is there any way of knowing how much the number is going to go up? I mean, and what do you do to mitigate fears?
We are in the early days of this pandemic, and in particular in this part of the world, in Canada and Ontario and Barrie, in Simcoe, Muskoka, we've only just had our first cases this week, and I fully expect that there will be community transmission in the near future, and for that reason we are advising people to take those protective measures to protect themselves, reduce the risk of others. We've also supported the province in their directive to close schools for a 3-week period, the next 3 weeks, and to disallow large public events or venues greater than 250 people, and to reconsider smaller venues. And I would say that our municipalities have really heeded that, and for the most part have discontinued all such events for the time being. All of those things are very important because they're necessary to flatten the curve, as they say, or reduce the size of this pandemic as it manifests locally.
Is there a way to mathematically figure this out, based on the curve, based how many are reported now, based on what happened in Europe or in China or anything like that? Can you guys extrapolate?
There is a mathematical model that has been created by researchers at the University of Toronto that we've looked at. Its most helpful aspect is looking at the potential benefit of these public health measures that I've cited, and according to that model, it can be very helpful. It can reduce the total volume of cases by as much as 95%, and so it really drives home the point of us proceeding with them and being aggressive and timely about them.
What about risk assessment centers? You're seeing popping up South Lake, there's a hospital in Brampton that have testing centers or risk assessment centers outside of RVH, outside of the hospital. Are you guys going towards that step, or is that the next step? When are you guys going to be doing that, if so?
For the past 3 weeks, we've been working with local primary care leaders and hospitals and through the North Simcoe Muskoka Local Health Integration Network to identify sites that could do that, clinics that could be converted into that. We've got 6 or 7 potential ones that would be able to be up and running, and we have one here in Barrie that we anticipate opening tomorrow is the expectation. So we do need the province's approval to proceed with those. The province is giving the support to proceed with the one in Barrie, and we're looking to the others. After all, our mandate covers all of Simcoe Muskoka.
Where's the one opening up in Barrie?
I would rather wait till the announcement comes out because I wouldn't want people to be going there early before they're actually up and running.
How has been the number of people calling into telehealth, into Simcoe Muskoka District Health Unit to get information? Have you guys been inundated? How's that been?
It has gone up exponentially, enormously, even through this week, such that we've had to redeploy a very large number of our staff to respond to this. Staff who normally do other things, other disease prevention programs that are curtailed while we put the resources into responding to calls and responding to inquiries about potential cases, individuals to be tested and followed up. It's gone up hugely, and I expect that it will continue to go up and stay up for some time to come.
What's the number one thing that you tell people when they call in if they think they've got COVID-19?
They need to isolate. If they feel that they could possibly be a case, they need to home isolate and avoid exposing other people. Then we can work with them about the options for further assessment, potential for testing. There is going to be a limited capacity to test, I'm afraid. We've got a limited supply of swabs, a limited supply of personal protective equipment, so there's going to have to be some degree of prioritization for testing. So the main thing for people that would actually be of low risk for developing complications and transmitting to others is that they would be isolated at home while they recover.
One of the things that I was asked today by somebody, when the assessment center comes up, the assessment center or test center?
Alternate assessment center.
When they pop up, are they not a danger themselves because there'll be so many people going there who think they have symptoms that other people might get it that don't, or how will that operate when they come about?
Certainly, the social distancing and infection control will be important there too, because they become a potential gathering, as you say, right? So we'll have to be careful about that. And look at models that can help address that. I do know some places are actually looking at a drive-through approach to help address that. So you raise a worthy point.
And you've said this several times over the last few days, but what is your message to people who are now going to see 2 more people and possibly panic even more? Just your advice to them when it comes to the panic shopping and the panic.
I think people need to be aware, more so than alarmed, and to take measured steps, measured actions, the kinds of infection control measures that I've always cited, and the single most effective one is hand washing, but the social distancing as well, and isolation of themselves if they feel that they are a case, could be a case, develop symptoms. And some time ago, a couple of weeks ago, we put out that the public should be prepared for the possibility of home isolation or quarantine for a 14-day period, and therefore should have provisions in their home, food, medication, otherwise, arrangements with friends or family to help support them if that were to come about, and take a graduated approach to getting ready for that. We have seen that indeed people have very much stocked up, and that's affected availability of some basic provisions. So back to the recommendation that they take a measured approach with that.
And just finally, as far as I know the schools are out and the rec centers are closed, it's hard to predict, but do you foresee this lasting, maybe the 3 weeks is up for the schools and someone will be like, no, we need more time, or is it, that's pretty safe, they'll be back to school?
Frankly, I think that's just the beginning. I think they've taken a measure for the beginning, and they'll have to wait and see how things play out, but I think that this is going to play out. They should think in terms of weeks and months, and then indeed there may very well be the need to extend these kinds of closures beyond the immediate action that they've taken.
What's next? What's the next things to close, in your opinion? Like, has that been communicated to you? And when was the last time you heard, in coordination with these, with the federal government or whatever, like a lockdown of bars, restaurants, keeping only pharmacies and grocery stores open? Are you guys close to that yet, or how close are you?
So we've seen that kind of thing in Italy, right? That would be the most extreme, or in China. But they've certainly had cause for it. They've had very large numbers of locally transmitted cases with deaths. We've had overwhelmingly cases that were imported or can be linked to imported cases. We've had very limited evidence to date of local transmission. That clearly can change quickly, so I don't want to be overly reassuring about that. I think people need to take very seriously the potential for local transmission and exercise the social distancing. If we're very fortunate, we will be highly effective with what we've done, and we may not need to go to more extreme measures, but I'm sure that as this transpires, we shall see. We shall see what else is needed. As you've already identified, Italy has done much more still and really prohibited any kind of public venues or activity apart from basic shopping and medications. We haven't gone there, and hopefully we won't have to go there. We shall see.
Okay, so you described that we haven't reached our spike yet, the peak yet. Like, we're still on the way up.
For the most part, we've really only seen cases that have been travel-related or linked in some way to travel-related. It can really take off when you get local transmission, and there you could get much more in the way of cases.
So the 2 new cases today, I mean, how concerned should we be about this? You know what I mean? Because the formulas say, you know what I mean, once someone in the area gets it, it's much easier. I mean, the 40-year-old that's at DRVH right now, how long are they expected to be there? Now that the numbers are going up, how much more concerned should we be?
So to be clear, the one that's presently admitted RVH is the male individual in her 70s, right? So the other one, 40-year-old woman, is at home recuperating, was travel-related. I'm more concerned when we start to see unlinkable cases that we just have no idea where they came from. The woman in her 40s was clearly travel-related. Man in his 70s, we are investigating what the link would be. But when we start seeing more and more in the way of unlinkable cases that appear to be just transmitted locally, then that is indeed an indicator of concern and the potential for it to grow quite a bit more rapidly.
It's difficult for you guys to walk that fine line of trying to make people aware of what's going on, but yet not trying to whip up too much fear and cause panic. How difficult is it to get a clear message out when it seems to be, well, be concerned but not panic? So how do you walk that line and how do you be clear?
Clearly, there's a potential for a lot of concern and a lot of anxiety, and we've seen that in some of the encounters with people who've been calling us, some of them extremely agitated, very concerned. I think the situation by its nature is very concerning, can be very alarming to people. The message I always try to give is that they should be aware and informed and take measured steps to help reduce their anxiety and be more effective. But it's a hard thing for all of us to do in the face of a disturbing situation like this.
So as much as we are concerned about the safety of our children at school and big events happening, we are still relying on our pharmacies and our grocery stores to stay open.
Mm-hmm.
So you have these people working in retail that are exposed to all these other people. What would you say to them to reduce
Mm-hmm.
their anxiety, and what kind of protocols could they put in place?
So they could be, when we start seeing local circulation, they could be at higher risk. So they need to be all the more aware of the kinds of control measures, keeping 1 to 2 meters apart. That clearly can be challenging in a crowded shopping environment. They need to be using hand hygiene, hand washing, hand sanitizing, self-monitoring, isolation if they develop symptoms. They need to be aware that by the nature of their work, they could be at a heightened risk in the future when we start seeing local circulation. And it's possible that with more stringent public health measures, that risk could be reduced by reducing the volume of people that are going out. We shall see.
If it does get to that point where it's not people that have traveled, but it starts to spread, people are going to present differently. So you may be carrying the virus, but not presenting in any way. What would you say about that?
Most people have symptoms. It's true that very young people can have minimal symptoms. That's one of the reasons why we're concerned about schools. Children actually aren't at high risk of developing complications, but they can spread it. So one of the ways of reducing spread is to close schools, right? To take that out of the equation. It's true that very elderly people might present non-specific symptoms at first. They might not mount a fever, obviously, at first. So I think they need to be aware just of vague symptoms to begin with. We certainly will keep the community informed if we're seeing evidence that it's spreading in the community, and people have to be that much more vigilant about monitoring themselves and identifying if there's any indication that they might be developing something, might be ill.
Good.
Well, I'm happy to have addressed you today. I'd be happy to do one-on-one interviews or answer any other questions as well.
Janice, did you want to say something about, like, I mean, can we fire a couple questions off at you, or?
Anything that Dr. Garner likes?
Do you? Just
Good morning, and Royal Victoria Regional Health Centre has been preparing for weeks for the COVID-19 outbreak, and so in that regard, we weren't really surprised to have a positive COVID-19 patient, just a matter of when, and because we're always prepared, we're a 7-day-a-week, 365 organization, we have been prepared for this eventuality. What's important to note that if people are to be at RVH today, that we have locked down many of our doors, and there are screeners at the door now, and they're in their protective equipment, and there'll be a series of questions asked of people, staff, or the public visiting or patients. And it's really important to stop, wash your hands, answer those questions. In addition to that, we have restricted our visiting hours to visitors 9 a.m. to 9 p.m., 1 visitor per patient, and of course there are always individual exceptions based on compassionate issues that we will face on an individual basis. In addition to that, as soon as we knew that we had a positive COVID patient, particularly an inpatient, our staff were informed. So last evening and through the night, if staff were on-site working, they were asked to go home and self-isolate. If staff were scheduled to be in the building today, they were informed to stay home, monitor their own conditions, and of course self-isolate until the 28th of March. In addition to that, we have now, as today, taken the measure that all elective procedures or non-urgent procedures at RVH are canceled, and we are now reaching out one-on-one to speak to our patients in that regard, and that is until further notice. Part of this, of course, trying to keep everyone safe. It's also, of course, recognizing that at a provincial level, there is a supply challenge, and so we're wanting to make sure we have the supplies where they're needed most in the moment. So those are some of the measures that we're taking: securing the perimeter, screening at the door, limiting the visitors, and when we know of a positive case, our staff who have been in contact with that patient are also fully informed, and we're working very cooperatively with Dr. Gardner, his staff, and the entire public health system to ensure that we are safe. If you need to come to the emergency department, you're not well, you've had an injury, you must come ahead. However, if you're curious about whether or not you might be COVID-19 positive, you'll see signs at the door now that indicate you should stay home and you should self-monitor and follow the precautions that are on the website. If your employer is asking you to get clearance from RVH before you come to work, that's also not a function that we would be playing. That individual should go back to their primary care professional where if the clearance is necessary. And if you are experiencing some mild symptoms, again, we'd encourage you to stay home and ensure that you self-monitor. And if at any time your condition worsens, of course you should come to our emergency department. But we need to find a way of being informed. We say be prepared but not scared, and ensure that in fact you're well informed, taking all of your precautions, ensuring that you're following all public health practices, self-monitoring, and staying in isolation until such time as you feel your symptoms have worsened, and then of course RVH is always there for you.
Do you feel that the walk-in clinics and family doctors have been inundated as well?
The entire system is beginning to be inundated, and as Dr. Gardner said, we do believe that this is the beginning as opposed to coming anywhere close to a peak. So we are working collectively with all of our partners in healthcare to try and assure our public and also ask the public to make sure they're staying well informed for that purpose as well. Tomorrow at 2 p.m., an assessment center will be opened in Barrie. It's really important to note that at this assessment center, we will not be doing the test, or as we say, swabbing patients. So we don't want the public to have expectations that that is in fact a function that will be performed at that assessment center. It'll be much more about asking a series of questions, and then if it's determined by the healthcare professional that swabbing is necessary, the patient will be redirected to RVH. And as of Friday and Saturday and Sunday today, we also have a space near our emerge where we've actually been able to divert the public who are concerned that it is a really uncertain time, but we have a space there where you're not coming into the emerge now, you're going to another part of the same physical plant, you'll be directed there, and again, those series of questions are being asked. And that's how we've been handling the numbers that have been showing up within the facility itself in the last few days. And we'll continue that on-site piece to make sure we preserve our emergency department for all of those emergencies that we still need to ensure we care for, as we typically have about 87,000 visits a year.
How long does it take to get assessed or get a test? Or, I mean, like if someone passes all the initial ones and then they get the swab, how long till you know? Well,
the swab goes down to the public health lab in Toronto, and it's varying. Of course, they're also being inundated with a number of tests. So I think that it's been on average about 48 hours, Dr. Gardner?
Or even longer as the demand goes up, though we have been able to get priority on situations of particular concern, so that on those situations it can be done much more quickly.
This might sound like a stupid question, I don't know if it is or not, but
there are no stupid questions.
How easy is it to treat COVID-19? I mean, at the hospital,
So there's no specific treatment. There's no drug regime. There's no vaccine at this point. The treatment would be supportive care, addressing the symptomatology and any of the complications and providing the support. So that can include admission to the intensive care unit, intubation, ventilation. Really, that falls more into the camp of care. And so I think I'll turn it back to Janice to speak to that.
I think Dr. Gardner outlined appropriately. It will really depend on the symptoms that the patient presents with, and be assured that we have a full group of health professionals, both our medical professional staff as well as our nurses, who are well trained. Currently, equipment is well stocked and we're prepared. We have some capacity within the facility at this point in time, but of course we're all planning ahead over the next few weeks, depending on the volume, how that will change.
So to that end, just talking about the number of ventilators, for example, since it's a respiratory disease or whatever, I mean, how many does RVH have?
We have 2 roles at RVH. We have ventilators for our intensive care unit, and then we also have a regional mandate to have 5 ventilators on in storage to assist with other regional issues. I think that the answer really is that the entire province, if not the country, is looking at the stock with respect to ventilators, respirators, to ensure that in fact we can begin to meet this demand. What I think Dr. Gardner said is we're obviously looked at Italy and what has happened there so rapidly, and the point is that I understand that we need to do everything possible to shorten that spike and elongate it. So in some ways, let's say as a layperson, as myself, it's better to see a COVID-19 being sort of active in the community, but less spikes around the volume. Is that fair?
Yeah, that's exactly it. They talk about flattening the curve. So you can, without good public health measures put in place, you can have a huge spike, like the situation in Italy, that can overwhelm the system and leave people very vulnerable because the inability of the healthcare system to respond to the volume. Or you can put in place those measures that reduce the peak so that the volume is still manageable within the system, and then those who become cases are much more likely to do well.
I just have one more question. I hate to step on anybody, but like, how are we in comparison to the States or Italy or China, for example, to handle a massive outbreak if there is one, or a pandemic?
I think the key is how are we doing to avoid that degree, to flatten the curve, where I think we've been given a golden opportunity with geography, how far we are away. And also the lessons we learned from SARS and being prepared that we have a very good chance of flattening the curve and reducing the volume, the peak volume of cases, the number of people that are sick at the worst of it, so that it's still manageable. That will be the key for us to achieve that. I think we have a reasonable chance of that. I think we're responding proactively now. Before we get evidence of widespread community activity. That is our best chance of doing well.
How do you determine success at this point? I mean, is it just a matter of waiting and seeing how the numbers play out, or how do you know you're being successful in your endeavors right now?
Certainly, surveillance is key, and we've to date been able to do a fair volume of testing. We're challenged in being able to do the ever-increasing volume of testing. We'll just have to do the best we can with that and monitor in other ways, like demand on the healthcare system, numbers of people reporting to emergency department with respiratory symptoms, evidence that we've got cases that are not linkable to travel, and the degree to which we abide by and put in place these measures is an indicator of success in itself. The fact that we've been able to have our government close schools and close large venues and have municipal government close smaller venues are success indicators in and of themselves. They're response indicators. The fact that our hospitals, such as RVH, are putting in place their strong measures to protect the hospital environment is an indicator of success in itself. All the preparation, the ability to set up and open assessment centers is an indicator of success. So we'll just continue with those directions, continue monitoring. I think in the end, I guess history will judge us as to how we do. It becomes clear after the fact how you did, and comparisons between jurisdictions or countries helps to provide some indication of how we did. We had a very hard time of it with SARS. I think we were hard hit, unusually so. Compared with other places in the world, I think we learned a lot from that, and I'm hopeful that this time around we will be among those that succeed the most.
Okay, one last question. What did we learn? What did we learn from SARS? Like, what are we doing differently now?
Well, we've had this whole, we've invested a great deal back in the years that followed SARS in public health. We put large sums of money into infection control and into agencies to support public health, such as Public Health Ontario or the Public Health Agency of Canada. For years, we had regional infection control agencies. We have rapidly put in place the testing required to do the surveillance. We made COVID-19 a reportable disease in January. It was done early, done quickly. We've created protocols for testing and isolation and follow-up in a prompt way, and then updated them as the information has changed over time. And to date, we've had a relatively limited number of cases, and they've been overwhelmingly travel-related. We've had a government that has now taken steps to reduce entry to the country via airplane arrival or via cruise ship arrival. And has recommended strongly that individuals who enter the country now go into home isolation and monitor themselves. So I think those are all indications that we've learned a lot from our experience with SARS.
I just have one more question.
This juice in the last.
I know, but it's about money. Do you guys know how much money you've spent? Have you blown the budget? Does it matter? I mean, do you guys think in those terms? I mean, someone's paying for this, I guess, so.
We are a public agency. We're accountable for the money that we receive from government, from municipal government, provincial government. Indeed, we have an annual budget that we have to abide by, that we have to report on, that we have to get approval on. We're accountable to our publicly appointed Board of Health. And so we do have some reserves, and we are tracking at this point the resources that we're expending on this response. That's includes the redeployment of staff. So we are tracking what gets redeployed and is otherwise not being used for other things. And we're tracking the impact that this is having on our other programs that are now curtailed. And we will be reporting on that on a regular basis to our Board of Health and to the province. And when it's all said and done, we would probably be seeking reimbursement from the province, but we shall see. Certainly that was the case with H1N1 influenza and with SARS. And if necessary, we'll draw on our reserves. And hopefully that would be sufficient between redeploying with the resources we have and drawing on reserves. But we'll take it one step at a time.
Have you ever had to, I mean, it's only March, mid-March. How deep into the budget are you? Does it increase it that much more? I mean, a pandemic like this, I mean, it's obviously unprecedented, so.
We've certainly had to redeploy before. We've had incidents, large-scale incidents. So in fact, something of this nature happens about once a decade, right? Now, this scale is unusual. In my mind, this is potentially once a century to have something of this scale. But about once a decade or so, we have something that's substantial, like H1N1 influenza or SARS, that really impacts on society and on our what we do. But in the past, we've had to redeploy our staff completely to address these incidents, and we're getting into that now.
No numbers.
Numbers. I don't have numbers for you off the top of my head.
Yeah.
We've redeployed enough of our staff that we've had to put on hold all discretionary activity or activity that could be put on hold for a limited period of time without a major and immediate negative impact.
much like elective surgery. Yeah, absolutely.
It'd be our equivalent to discontinuing elective surgery.
That's fair. That's fair.
Yeah. Post-board meetings, we would have more figures about how much, because we
Yeah.
are tracking.
It's minor. Yeah, okay, just wondering if you did, that's all. I don't have anything else.
Well, thank you very much, my pleasure.